Welcome to The Explainer. I'm absolutely thrilled you're here today because, well, we're about to solve a pretty incredible medical mystery together. You've probably taken paracetamol, maybe countless times, when you were stuck in bed burning up with a fever. It is literally one of the most common medications on the planet. But have you ever stopped to wonder what it's actually doing inside you? Today, we're going to completely crack the code on this everyday medicine.
Let's start by debunking a massive myth right off the bat. When you take a paracetamol tablet, it doesn't just act like some biological ice pack. It doesn't travel through your veins just chilling your blood or spraying cold water on your overheated organs. It is absolutely not a body coolant. The way it actually works, it's far more elegant and honestly a lot more complex than that.
So how does it actually work to bring your body temperature back down to normal? Well, to figure out how the cure works, we first have to understand the biological problem. We really need to look at exactly what happens inside your body when it deliberately decides to turn its own temperature up.
Okay, let's dive into this. Part 1, why do we get a fever? Here is the sequential chain reaction. Step 1, your immune system detects an invader, like a nasty virus or bacteria. Step 2, in response to this, your body releases a wave of inflammatory signals. And then step 3, these signals cause a massive spike in the production of something called prostaglandin E2, or PGE₂ for short. You can kind of think of PGE₂ as this highly urgent, blazing red text message being sent straight to your brain.
And where exactly does that urgent message go? It travels right to a vital region called the hypothalamus. I want you to build a really strong mental picture here. The hypothalamus is, for all intents and purposes, a literal thermostat sitting right inside your brain. Just like the thermostat on your living room wall that keeps your house comfy, your hypothalamus usually keeps your core body temperature hovering right at its normal, healthy range.
But when that surge of PGE₂ finally arrives at the hypothalamus, it forcefully pushes your body's temperature set point up. It essentially reaches out and just cranks that dial. So suddenly, your brain absolutely believes that your normal, healthy body temperature is actually way too cold.
Which leads us to a fascinating and honestly super relatable question. Why do you shiver when you already have a fever? I mean, have you ever been tucked under 3 heavy blankets, absolutely burning up, but your teeth are just chattering away? You aren't actually cold because the room changed.
You're shivering because your brain has completely changed your temperature target. Because your hypothalamus now genuinely thinks you're too cold. It triggers this whole cascade of physical responses to generate heat. Your blood vessels constrict, that's vasoconstriction, to keep heat away from your skin. You start to shiver just to generate friction and warmth. Your body is desperately trying to conserve heat so your core temperature can rise up to meet that brand new, much higher target set by your brain.
Which brings us to part 2. Enter paracetamol.
So your thermostat is cranked up and your body is generating all this excess heat. Let's shift gears to the solution and track the actual tablet. You swallow the pill, it absorbs through your GI tract, enters your bloodstream, and travels straight up into your central nervous system. Once it's there, paracetamol reduces the synthesis of those prostaglandins. So you can essentially picture this drug arriving at the brain like a tiny messenger, gently tapping the hypothalamus on the shoulder and saying, hey, you don't need to keep the thermostat this high.
And this brilliantly illustrates the core pharmacological mechanism at play here. By reducing the production of central prostaglandins, the level of PGE₂ drops, and without that constant inflammatory alarm bell pushing the dial up, the hypothalamic temperature set point finally returns to normal. The drug literally resets your biological thermostat.
With the thermostat finally fixed, your body suddenly realizes, whoa, wait a minute, we are way too hot. And that is when the relief phase kicks in. All those heat-conserving responses we talked about, they completely reverse. Your blood vessels dilate, meaning they widen back out, rushing warm blood to your skin. You might start to sweat a bit. All this allows your body to finally shed the excess heat it was trapping, and your actual body temperature gradually comes down.
All right, moving on to part 3, the nuance, paracetamol versus ibuprofen.
If you go open your medicine cabinet right now, you've probably got both paracetamol and ibuprofen sitting right there. They both treat pain, and they both treat fever. So are they just the exact same drug in different packaging? Well, no. While both influence the same general pathway, their pharmacological profiles are actually quite different. Ibuprofen is what we call a conventional NSAID. It has significant anti-inflammatory activity out in your peripheral tissues. Think of a swollen knee or a badly sprained ankle. Paracetamol, on the other hand, is absolutely great for pain and fever, but has very weak peripheral anti-inflammatory activity.
So the million-dollar question here is, why?
Why is paracetamol such a heavyweight champion at reducing fever in the brain, but it doesn't fight physical swelling out in the body nearly as strongly as ibuprofen does? It's honestly one of the most intriguing quirks of its pharmacology.
It all comes down to the environment. You see, paracetamol works wonders in the relatively clean, stable environment of the central nervous system. But out at the sites of significant physical inflammation, again, picture a really swollen, red, angry joint, the biochemical environment is super messy. This highly specific, chaotic chemical environment actually reduces the effectiveness of paracetamol cyclooxygenase, or COX, inhibition. And that is exactly why it excels at bringing down a fever, but isn't considered your go-to conventional anti-inflammatory drug.
Let's pull this all together. Part 4, the full fever mechanism.
We've gathered all our clues, so let's do a rapid-fire recap of this entire medical story from start to finish. Ready? Here's the chain reaction. Step 1, an infection triggers inflammatory signals. Step 2, that creates PGE₂, which directly raises your brain's temperature set point. Step 3, your body responds by shivering and conserving heat. Boom, you have a fever. Step 4, paracetamol is introduced to the central nervous system. Step 5, it lowers that central PGE₂, dropping the set point right back to normal. And finally, Step 6, your body releases the trapped heat and your temperature comes back down. It is cause and effect, beautifully illustrated.
If you take away just one clear mental model from our explainer today, make it this one simple concept. Fever means your biological thermostat is turned up. Paracetamol works by turning that thermostat down. It doesn't magically freeze you, it just changes the cellular signaling that tells your brain what temperature your body should be maintaining.
It's pretty incredible to realize that a tiny, cheap, everyday tablet is doing something so profoundly complex right inside your brain's main control center, isn't it? Which leaves me with one final question for you. If paracetamol is doing all of this, what other simple, everyday medicines are secretly hacking your body's control centers right now? Keep that in mind the next time you pop open your medicine cabinet. Thank you so much for joining me for this explainer. Keep seeking those answers, and I will see you next time.